If you have Medicaid or any government-sponsored health plan, stop what you're doing and listen up. Since the pandemic was declared over, auto renewals have ended, and more than 18 million people could lose their coverage. Did you hear that number? More than 18 million people. So, do you have Medicaid or a similar health plan? If you do, you may have lost your coverage and you don't know it. The worst time to find out that you have lost your coverage is at the doctor's office when you need it the most. So stay tuned, because today we are talking Black women, health disparities, inequities, and access. And joining me for this conversation, very important conversation, is my dear friend, Dr. I'll let him explain that, Errol Pierre, who is the SVP of State Programs at Health First, the largest nonprofit provider of health insurance here in New York, serving 1.8 million members. And I'm happy to say I'm a card-carrying member. They didn't pay me to say that. And I love my insurance, just so you know. I'm very happy. Happy, happy, happy. Okay, so before we get into that, I have to welcome you officially, because I just, got into it. I have to welcome you. Welcome you to Detox Living, where we bring you tips, truths, and testimonials to power your toxic-free living. The past couple of weeks and recent past, you've heard a lot of great testimonies. And right now, we want to make sure that you are empowered with information that will help to support your health journey in a vital way. So I am Coach Gessie. I am a fibroid survivor turned health activist and founder of the DETOXnow.com, a holistic health provider of education and supplements that help to close the gap on those disparities that combat obesity, chronic disease, reproductive health issues, as well as other inflammatory conditions that lead to lower life expectancy rates. So join me in welcoming, I see him here. Hello, it's so good to see you, my brother.
You too.
Doctor, I get to call you doctor now.
Absolutely.
Yeah. So first of all, you are my Haitian brother too. We have to pray for our country and everything that's going on right now. It is.
Oh yeah, it's absolutely.
It is heartbreaking.
Yeah. I was actually in the Dominican Republic last week.
Okay.
In the north, in a town called Monte Cristi.
Okay.
It's literally
right across
the border. So we were there for a humanitarian trip. We actually were able to take care of Haitians that were able to cross the border and get health care, which was a beautiful thing.
The situation is desolate.
Dire straits. It's unfortunate.
Oh my God. We're talking about Haiti. We continue to pray for our country. And
100%.
Yeah. And thank you for the work that you do as a humanitarian, going and it's not always easy. I know you go there, and it's not always easy. So
shout out to Kenya. They sent 1,000 troops to Haiti to help.
Come on, Kenya.
Absolutely.
Thank you, Kenya. So the crazy thing about it is the gangs are fighting the corruption, but they're not doing it in ways that the people are suffering.
Yeah.
In the ways. I personally have a cousin who was kidnapped twice. She's actually a journalist out there.
Yeah.
And it's so much corruption. And I'm not mad at the fact that there's resistance because of the corruption at all levels.
Of course.
Right?
Of course.
God. So, but tonight, first of all, I want them to know who you are. I told them I'm a proud Health First card-carrying member, right?
I heard.
Yeah, I really am. I honestly have I never have any issues. And if I do, I'm able to get them solved. Your teams are amazing. So I wanted to dig into the issue at hand, which is Medicaid recertification. I know it's called redetermination in some places because some of you may be listening outside of New York, of course. But before that, I want them to know who you are and what you do at Health First and how you put that doctor on your name.
Absolutely. Happy to be here. So my name is Errol Pierre. I'm the Senior Vice President of State Programs at Health First. That means I oversee product and sales for our Medicaid products and also our commercial products and our long-term care products.
Now, when he says products, you may think, something physical, but he's talking about healthcare programs.
Insurance.
Healthcare programs are the products that he's talking about. So he's talking about like healthcare for your children, healthcare for your family. Okay.
Yeah, exactly. And Health First, we were founded in 1993. So this year is actually our 31st anniversary.
Wow.
31 years. Mm-hmm. We are a nonprofit. So when we have money left over, we return all of it back to the providers and the physicians that we work with, which is a beautiful.
I want to come back to talk about that.
Yeah.
Because I have some questions about that, but let's keep going.
And we now have 1.9 million members.
Ooh, oh, excuse me. Hello for the upgrade. I ain't get the memo. Yeah. I had 1.8. Let's update that. 1.9.
We're just shy of 2 million. And, we are all over New York City, Long Island. We actually stretch into Hudson Valley, Rockland, Orange, and Sullivan County, delivering high quality care. The only two things I mentioned too is we really believe in quality. So New York State ranks plans using stars. Mm-hmm. For Medicaid, we're a 5-star plan.
Wow.
For plan, we're a 5-star plan. For Child Health Plus, we're a 5-star plan. For HARP, we're a 5-star plan. And then in Medicare, the federal government, called CMS, that's the entity, they do star ratings for Medicare. And we're a 4-star Medicare plan. That's the highest rating in New York. So
what does that entail? So at first, two questions there.
Yeah.
So when you say New York State Health First serves members in New York State, does that include upstate? Does that include Buffalo? Does that what does that include?
It's the 5 boroughs of New York City, mm-hmm. Long Island, mm-hmm. and then Hudson Valley.
Okay.
So
that's the territory.
That's the territory.
Okay.
And then the state.
Is Staten Island included?
Staten Island counts. That's the 5th borough.
I'm sorry, y'all. I'm sorry.
Yeah.
Okay. And then the other thing you just said was, so the ratings, let's go to those ratings. What does that actually, wait, hold on. You still didn't tell us how you put that doctor on your name. You think you're going to skip that. You went right into the meat and you skipped that.
I know. Yeah. So ironically, having Haitians, they're like, you must be a doctor.
So the African parents are like that too. And people of color, we got that burden.
And I didn't want to be a doctor. But
not a medical doctor.
Exactly. So did my undergrad at Fordham, did my graduate degree at NYU.
NYU alum in the house.
There you go.
I was undergrad.
It's okay. It's okay. And so I did my graduate degree in financial management and health policy. Mm-hmm. And so I read a lot of articles about health disparities. So looking at populations where some populations are healthier than others, it's such a deep-rooted issue. Mm-hmm. A lot of it has to do with how we allocate resources in the community. It's not allocated in an equitable way, meaning the zip code can dictate your life expectancy, which is crazy.
It's crazy that it's still a reality.
Yes.
Like it is still a reality.
Yeah.
This is we knew about redlining where it affected the home ownership, right? But it's actually affecting your access to care, your access to food, food deserts, education, right? All of those social determinants of health. Exactly. That I love when you talk about that. Talk a little bit about that.
Yeah. So people think to be healthy, you need to see your doctor. Seeing a doctor or a physician only represents 20% of the reason why you have health. Only 20%. Right?
20%, y'all. 20.
80% has nothing to do with seeing a doctor. It has everything to do with your what they call lived environment. So it's the food you eat, it's the neighborhood you live in, it's air quality. So for example, if you live in the Bronx underneath the Cross Bronx Expressway, you're breathing in exhaust. So many of the children in the Bronx have asthma because of their lived environment. To nothing that they did. It's because they live with trucks passing over them every day.
Right.
You only have access to, if there's more Burger King and McDonald's than fresh fruits and vegetables.
Black and brown neighborhoods,
exactly.
Right?
Exactly. So this all adds in. And then he speaks to the types of physicians you can see. If the top physicians that graduate from the best schools only give care in Midtown Manhattan, then you don't have access to the best quality care, right? And if those places where you do get your care or where you try to work out or your parks, they're not taken care of. You know, I lived in the Bronx for 18 years. I can't remember the last time I saw a rim with a net on a basketball court. All the nets are always missing, right?
Yeah.
So if you try to go out and do physical activity, but the lived environment isn't conducive for working out, or it's not safe, or there's whatever's happening, that all leads to health. And it's the 80% that we're trying to focus on, not the 20%.
Yeah, that's actually what connected us, right? Because, you know, of course, we do work at educating people on what they can do to take back their health, right? What's in your power, right? And understanding that nutrition is a really big piece, the food that you eat, the food being your medicine, and why in Black and brown communities, you don't find, you know, health food stores. You find more of the bodegas, right? More of, and on the financial side, you find more check cashing places than you do banks, right? And that's very intentional. It's intentional in terms of the businesses that come into that community. And it's sad because we need to keep money in our community in order to grow it. So we're in this vicious cycle
100%.
of taking money out in order to get quote unquote better, right? And our own community suffers, right? And it's very much a lot of what integration did, honestly, to our communities, because we had thriving Black communities. And then, you know, we were seeking, my husband likes to say, it's that the grass is greener on the other side. You know, we drank that Kool-Aid, right? We believed that, and we abandoned our businesses, or they were massacred, like the Black Wall Streets, right? Or they were literally, you know, massacred, and then we had to start from scratch. So that, I believe what you're saying, that there's no question the lived experience has a direct impact on your health. In fact, there's a statistic that says that I think it's 5% of health conditions are genetically determined, right? And another 95 is through lifestyle, right? Again, so much power in our hands in terms of what we can do, right? So, but that brings me to like one of the key things. A key determinant on this is access to care, right? Access to care and being able, I love that at Health First, I'm able to go to my doctors. Again, I'm able to choose my doctors. There are certain things that cost a little more if you are not a quote unquote in-network doctor versus not. And this, I know this is not a drive for Health First membership. I'm just sharing that I appreciate that, right? But the biggest thing that we're talking about now is that's an important thing, be able to choose the doctors that you have. So, but let's talk about the Medicaid, you know, recertification in terms of what is the greatest issue threatening access to health care now that we are post the COVID-19 pandemic?
Yes, great question. So when COVID happened, the federal government did something very, very important. What they said was, we just want people to get to the doctor, whether it's for a COVID test, a COVID vaccine, or for any medical condition. If they feel sick, they should just go. So in their infinite wisdom, they said anyone on a state program like Medicaid, like Essential Plan, like Child Health Plus, these are all state programs that are offered through New York State and across the country. They said, you don't have to renew your insurance. We're going to automatically.
There's a lot going on, right?
Absolutely. The last thing you want to worry about is renewing your insurance when you can't leave your house, you're quarantining, you don't know what's going on. Maybe you lost your job. So they said, don't worry, you don't have to renew. And that was during the public health emergency, they called it. And if you were on Medicare and you had Medicaid, we call these folks dually eligible. So they're over 65, they have Medicare, and they also are eligible for Medicaid. Those members also did not have to renew, right? So that's great. So people kept their coverage from 2020 all the way up to 2023. They did not have to renew. Some of them didn't even know, but it was just great that they never fell off. Then once 2023
that was very important, though. I mean, because honestly, it's like we're in a crisis. I'm saying, wait a minute, do I have insurance? Like that was exactly that was very necessary.
So it was one of the best policies that the United States did. Granted, what ironic is it took an emergency for us to say, let's just cover everybody.
Yeah, I know.
Right. So most developed nations, Britain, Canada, they cover everybody all the time.
Right.
For the West, they said, let's do it because it's an emergency. Right. So that lasted for 3 years. Then come May of 2023, they said the pandemic has subsided. It's now over. So now everyone now has to renew their coverage if they have a state program or if they have Medicare and Medicaid. So that meant 91 million people in the country.
Hold on a sec. Oh, so the 18 million was New York. 91 million in the country were impacted, could lose their coverage once the pandemic was officially over?
So think of it this way. They take the 91 and divide it by 12. Everybody had to renew based on their month that they started. So if you enrolled in June, then on June you had to renew. If you enrolled in August, then come August you had to renew. So 91 million people in these 12 different cohorts had to renew. Wow. So we're not going to be done doing this process until this coming July. Wow. We'll be all done across the country. We're focused on this process in New York of getting people to renew.
Right.
Now, here's what's crazy. Renewing is not easy. Because
right. That's the thing. That's why it took like all hands on deck effort.
Yes. So think of it this way. You're either new to Medicaid. Maybe you had coverage through your employer. And then when the pandemic hit, your employer laid you off. And then you found out about Medicaid because you had no insurance and no job. So you enrolled in Medicaid. Right. So those people never had to renew their coverage before. Wow. But they had coverage for 3 years and never did it. So you have that bucket. Wow. Right?
That's they don't even they're on the clueless pile. they need all education A through Z.
Exactly. Then you had people that are used to being on Medicaid and they knew they had to renew, but then for 3 years we're telling them, don't worry, you're active. Don't worry, you're active. So now after 3 years we're saying, oh, now you have to renew. They said, yeah, but last year you told me I was fine. So am I fine this year? And what date do I renew? I don't even know when I do it.
Right. Because it's not everybody, it's a rolling thing depending on when it started, right?
Exactly. Then there's only 2 ways to renew in New York. It's a paper application, which is only for specific people.
What?
Yeah.
Well, yeah. What?
Yes, it's a paper application. So that paper application is very robust. It's very complicated.
Of course it is.
It's only
nothing. A few pages.
It's predominantly in English. So if English is not your first language, you need help to fill it out.
Yeah, that part.
Filled out in a timely manner. It has to be mailed in a timely manner.
Physically mailed. So it's paper, physically mailed.
English only.
English only. Okay.
That's about 20% of the Medicaid population that did it through paper.
Okay. But you said there's a second way. What's the second way in New York?
Well, I'll just say, so it was 20% plus any of the seniors. If there were seniors over 65 that had Medicaid, they had to do a paper application too.
Why?
That's the way New York sets it up. If you're
because you don't know how to use technology, they assume.
The reason being is they want to. So usually these paper applications are done with someone at New York State, so they want to.
Okay. Well, that's a good point right there. So let's frame that picture. So we're going to go to that. Let's put a pin there because we're going to come back to that. Okay. So all right. So because we're going to talk about how health first. That's the next question. Is how Health First has actually tackled this.
So 20% are doing paper. Then 80% do it online.
Okay.
Now, online, you have to have an email address,
Mm-hmm.
an account in something called the New York State of Health. Every state has their own website on how to do it.
Mm-hmm.
When you enter, it's the same application on paper, but now it's digital. They ask you all these questions.
You may not even have the answers at hand right away, right?
So, like, if you're an immigrant, they need to know.
Save it and then come back.
You can save it and come back. You can save it.
Because if you couldn't, that was
no. You can save it and get back to the same spot you're in. But they ask for pay stubs. Show me your pay stubs so I can prove that
you have to scan them and upload them like documents. Yeah. Okay.
They would ask, if you're an immigrant, they would ask for your most recent visa. Mm-hmm. Like, show me that you're legally documented in this country.
Right.
They ask for your zip code, where you live. They ask for your family size, because
they're giving it's healthcare, full healthcare. So you got to make sure that this is not someone who's scamming, right?
Right. So online application takes about 45 minutes, and the website is only in English and Spanish. So again,
so English is your second language. You may need a translator there with you, right?
Exactly. So, so people would go through this process, and then some people would find out that they make too much money from Medicaid. They would have to get moved to a different product. We offer all of these products, right?
Right. There are different levels. And so the first group of people, just going back, first group of people were people who never even knew that they had to apply. They basically qualified. They lost their jobs during the pandemic. Boom. They were basically kind of, just absorbed in. I don't know.
Yeah,
like they were just offered, like, here you have Medicaid because you have no job during the pandemic. So they had never even done this process. Then there are people who, yes, they applied, right, to recertify, but now they actually have a job and now they no longer qualify for that specific offering, right?
Correct. Yeah, absolutely. And then I said, like, there's people who have been in Medicaid for a while, but they were told for 3 years they don't have to renew. And now we have to tell them how to remember how to do it again.
Oh, wow. Okay, yeah, that was the second group. The third group is the person who now no longer qualifies.
And then you have the people who are using the paper application, and then any language barriers and things like that. So this was a big group. So for us, it was 1.2 million members at Health First that we had to renew. For the state, it was close to 7 million. And so it was a lot of people.
Wow. So now, in terms of how Health First approached this, right? Because I think it takes, evidence of care is the resources that are attributed to and allocated to making sure something is taken care of, right? And I'm pretty impressed at how, and I'm grateful I've had an opportunity to partner with you all to get this information out. But I'm pretty impressed at how it's really been an omni approach. Can you talk a little bit about that?
Yeah, 100%. So we had this concept of no wrong door. Wherever we could find people, we wanted to tell them about this information. And we said, even the people would say, I don't have Medicaid. I was like, even if you don't, I guarantee you know someone who does. Right. So share the story, right? You can always share the story. So what we did is, we know some people like text message. Some people like phone calls. Some people like snail mail. Some people like,
Oh, Lord have mercy. If I could never get a physical piece of mail again, I tell you.
I hear you. Some people love it. Some people love
I know.
it. And some people like the old-fashioned, like, knock at your door. I'm in front of you, right? Yeah. So this was really, really cool. We worked with our analytics to sort of look at our population to find out what's their preference.
Okay.
So the text message.
That's very caring. Find out how they prefer to be communicated with.
Exactly. Not only that, it also allowed us to use our resources judiciously.
Yes.
So we weren't robocalling 1.2 million people. We knew the people that like to pick up the phone. We said, oh, let's call them. The people that
because y'all would have been on the spam list. Like, no, block Health First right now.
Exactly. So 90 days before that cohort was up for renewal, start to do these pre-message educations.
Okay.
Hey, did you know your care will end soon? The 5 things you need to know.
Wow.
Hey, you aware this recertification process has begun again.
Wow.
Press 1 if you want to hear more about it. We can book an appointment. You can do your recertification online, or in person, or over the phone. However you want to do it, we can do it. You can book your appointment online. So you can go to a link and find someone that speaks your language. You can look at their picture.
How many
you can be like,
languages did you offer in terms of?
We speak in over 50 languages.
Wow. You speaking of?
Not I. I'm working on English. I'm still working on my English. But.
Over 50 languages. So that is very inclusive and encompassing in terms of serving the members who need access. And, you know, and I want to be clear now, this is because some people will think, oh, Medicaid is only for people who are at a certain income level. You can have a child, like when my daughter was born and she was in the NICU, she had Medicaid because she was considered disabled, right? We have kids who are dealing with disabilities of different kinds, family members who are disabled in different ways, even children just of certain age, under certain age, don't they get Child Health Plus, right? So this is more than, I want to make sure we're painting the right picture of who can, your child has autism, or your child needs occupational therapy or physical therapy. You're most likely using those services for your child because those are very detailed services, you know, or you have an elderly parent, right? Or a parent dealing with a very chronic health condition. These are people who cannot afford to not have their health care, right?
100%. Yeah.
And you may be the person who need it. See, so important. Therapy mom here. Exactly. So you may be the person, you may be the caregiver of the person who needs these services, right?
Exactly. I'm glad you brought that up because there's still sometimes a stigma around Medicaid. Yes. What is it?
Yes.
And so I'll give you an example. Anyone who makes $15 an hour or less is eligible. But here's the difference. And that's roughly like $20,000, $25,000 a year. Right. If you're a mom of 3, right, you can make close to $40,000 and still be on Medicaid because now that you have more kids, the income level increases.
Right.
If you're a pregnant mom, you can make roughly $45,000 and still get on Medicaid because the state says, I don't want you to pay copays and deductibles. So while you're pregnant as a woman, will increase the income threshold to get Medicaid.
You know, let's stay there for a second because that's a huge piece too with Black maternal health, right? And now Medicaid actually is extended to coverage postpartum. I was at the Congressional Black Caucus Sojourner Truth Legacy Project yesterday. I was recognized as a change maker in health equity. And thank you.
You are a change maker.
Thank you.
Congratulations.
Thank you.
Well deserved.
Thank you. And Representative Robin Kelly was one of the leaders on that legislation to make healthcare maternal coverage postpartum extend to a year postpartum, right? Which is very important because how many women fall through the gap in post-maternal care, postpartum care, right, in that first year because their coverage was just no longer available.
It's actually, when you take a step back, it's crazy that it took till now for that to happen. So it'd be like, oh, now you're a pregnant mom. Let's put you on Medicaid.
Who was there yesterday? Yay! Yes, it was a great event. Somebody said there was a great event yesterday.
So imagine you're a pregnant mom, you get Medicaid, right? And even if you make $40,000 a year, and then as soon as you give birth, they say, congratulations on your newborn, you're kicked out.
Crazy.
So now
you're on your own.
Yeah. So now you're like, okay, I don't have Medicaid, so now I'm maybe paying premium for insurance. Wow. I have a copay and a deductible, and I have a brand new baby that needs coverage. It doesn't make sense.
Those Pampers cost $80.
It's crazy. So the fact that they now say past 1 year of the birth, you can stay on Medicaid regardless of your income means you can get your postpartum care. Wow. One of the biggest gaps we have is the percentage of Black women not getting postpartum care. And this is not to blame them, it's to blame the system that doesn't allow them, doesn't enable them to get their postpartum care. And so one of the biggest things is like dropping them off of coverage after they have a baby. What do you think is going to happen, right?
Right.
So, yeah.
Because now it's become a financial factor, right? I know that Health First did a study and participated in a study around what things looked like what kind of outcomes were changed when they provided more of those gap services in that postpartum period. Can you share some of that?
Absolutely. So we work with Mount Sinai. They're one of our hospitals that we partner with. They sit on our board. And we wanted to see if we could get equity in postpartum care visits. And so we took Black and brown women that were in the area of Mount Sinai, which is Upper West Side on the east side, and gave each of them a care manager, sort of a social worker, someone that they could speak with and help them through it. And providing this resource to those moms, they had the same postpartum care visit rate as affluent, white, well-to-do white women. Same rate.
Close the gap. That's what equity is.
Close the gap.
Equity is
what
you
they
close
do.
the gap.
Yeah. What did they do? They said, oh, transportation is an issue for you to get to this care. On your Medicaid benefit, there's transportation. Did you know that? Didn't know. Okay. I'm going to call your car to pick you up and bring you to this doctor's visit so that we close the gap. And now mom is like, I used to get a Lyft and spend $40 to get to the visit. I didn't know Medicaid covers it, right?
Wow.
Or it was, like you said, formula is expensive. What do I do?
Yeah.
Like, let's get you part of a WIC program where we can get you either really reduced fees on formula or let's get you free formula. Oh, I didn't even know that program existed. That's awesome. That's great. So they literally were helping them. Let's book your appointment. Oh, you're working that day? Okay, I'll help you reschedule that appointment. So at least you don't miss it. So that having that person help you, we were able to get equity. It was beautiful. Wow. And by the way, when you get those postpartum visits, what you see is death goes down. The highest rate of death happens within 30 to 60 days after pregnancy.
See, I need you to talk about that more. What studies have shown that? They've shown that. Did you hear that? The 90% of deaths, did you just say that number?
High percentage, not 90, but
high percentage of deaths in Black maternal, we're talking about in maternal mortality here, right? A high percentage of them are after the birth, right?
Which is like postpartum care is so important because that's when you say, this is what I'm feeling. Is that normal? Oh, by the way, I had bleeding. Is that supposed to happen?
Right.
That's when you have to have the postpartum care to find out these things ahead of time before you end up in an emergency room.
And what was that window of time you said again? I want to make sure it's
30 to 60 days. 30 to 60 days.
30 to 60 days. 30 to 60 days.
I'll send you that study.
Yeah, that's really important. Because we think about the baby after the baby's born, but the mother needs care, right? The mother needs care. We need to make sure she's okay. Yeah. And so much of this is preventable if we close. That's the equity. Yeah. If we close those gaps, right? What is the status of that study and how it could be implemented around the country? Because I know that was something.
Yeah, we took those findings, we published them online so that other people can find them. We consistently work with other community-based organizations to share this information. Health First now has something called Health First Cares. And within that program, there's a maternity care program where we do have care managers that follow up on high-risk births. So we've taken those learnings and pulled it into what we do every day for moms.
That's phenomenal. That's phenomenal.
Another thing too, we started using analytics. This is pretty cool. Based on who we found has complications, we're using that data. And this is now using AI to benefit Black people as opposed to AI.
Right.
And now we're using it to say, because these moms went through this new mom that enrolled, there's a high likelihood they'll go through it too. Let's intervene early. So we're using those metrics.
That's what we call, what my colleague Kimberly Seals-Allers of the Earth app talks about learning from the living.
Learn from the living.
Learn from the living. Let's stop waiting for Black women and brown women to die to now find out what we need to do. And let's learn from the living so that we can save more lives, right?
astute comment. It's such a great phrase. I love that phrase.
Yeah, no, it's phenomenal. So the next question is, what is, and I think, we're talking through it, but what is the health equity impact? Let's drill down here. That is connected to this specific effort.
Yeah. So we talked about disparities. Black and brown populations have higher rates of obesity, diabetes, hypertension, chronic diseases, comorbidity,
fibroids.
Fibroids. And so we say, why? It's not the fact that they have black skin that makes them have a higher proclivity to being sick. It's not black equals sick.
Not race. Let's stop saying race is a factor, because it's not race, it's racism.
Exactly, right? So it is, one, which we didn't even talk about, implicit bias. And two...
But stop. No, stop. Come back. Let's dig right into that.
So implicit bias, and this is where I did a lot of my study and work on when I was doing my doctorate program.
But that's how you became a doctor. Finally, we get it.
So the implicit bias is specifically speaking to bias that exists, so treating people differently, that is not necessarily done intentionally, done unintentionally without knowing, and it seeps into the systems of things that we... So it's like, what does that look like, right? And this is what we call systemic. It's systemic racism, essentially. It's a bias.
It's baked into the system.
It's baked into the system. So they say, hey, what do you mean? What does that look like? Okay, baked into the system. What that means is I go to see a doctor. That doctor, and we have data that shows this, has less minutes with me inside the examination room than a same patient that has a different color of skin. So
what's the time look like? What's the difference? Do we have data on what that looks like?
We do. I don't know at the top of my head.
It's not seconds.
It's not. It's statistically significant, meaning there is a
measurable. It's worth of a differentiation.
The differentiation matters. So, the study was looking at a hospital in Philadelphia. Black patients, it was less words spoken from the doctor. So the doctor said less things, was curt, was shorter. There was not enough information shared between them, and the visits were shorter. So how can you, one, understand what the patient's going through, two, build trust, so that you feel safe to even talk about it, and then three, there was this feeling of condescension. Absolutely. That they were being looked down upon. So like when they say, when they ask you intimate questions like, do you have a history of diabetes? And then it seems like they're flippant about it. Like, really want to say yes? Like, if you feel that you can't trust the person you're sitting with, right? Or, nowadays, every doctor has a computer in the examination room, so they have their back towards you.
The whole time. And
they don't even turn around to, like, look at you in the face.
Not to acknowledge you as a person, to see you and to connect with you. This is supposed to be my partner in care, right? Because I've come with my issue to cooperate and partner with you to help find the right solution together.
Exactly.
And I think that's, the dismissing that comes up all the time, disregarding of pain. I told you, I dealt with that personally, where a doctor tried to send me back home after I had been diagnosed with CTA imaging with a significant aneurysm. Like, oh, sure, come back in 8 days. I was like, no, what? Yeah. And that's unfortunately, there's also a study you talk about with the children, the babies, and the difference between the care that is received. Can you talk about that study a little bit?
Yeah. So this was a big study that came out during the pandemic, I think 2022, which showed the survival rates of children when they're given birth to by a Black OBGYN versus a white OBGYN. These are Black kids.
Delivered.
And what
they're delivered.
Right. And what the study showed was, in essence, there's more what they call physician effort.
Wow.
The physician tries more inherently when they match the same race as the baby.
Concordance.
They're listening more. They're more sensitive to the needs and wishes. They care more. And this also speaks to implicit bias, because back when the slave trade would happen, literally they would look at the people that were up on the planks and say, "Oh, she has big hips. I want to buy her. Oh,
Yeah.
he's big and
Breathing.
he can handle pain. I want him." And that seeps into the doctor's office where they say, "She's big. She can handle the pain."
Mm-hmm.
So when she told me that on a scale from 1 to 10, her pain's an 8,
Right.
it's really 5. She can deal with it. When the same other person who might have a different complexion says, "I'm in pain," they run over. They're like,
Yeah.
"Are you okay? Everything okay?"
No, I was post-op and I had I'll give you a quick story. I'd had one of the fibroid surgeries. I forgot which one it was. And, it was actually a partial hysterectomy and small bowel resection. So it was 2 surgeries. And at this point, I'd had at least 6 surgeries. So I had a high threshold for pain, meaning I'd been through a lot, right? And I'm having severe pain, and I'm saying to the nurse, something's wrong. I'm like I know this pain. I've had these surgeries before, right? Like something's really wrong. And I typically will wean off of the heavy narcotic pain medication because it also affects my digestive, my intestines, which is a whole other factor because of all the surgeries I've had from complications from the fibroid surgeries that impacted my small intestines. So I'm telling her that she says, you should try to get off that pain medication. Do you really need it? I was like, listen, if I'm telling you I'm in pain, this is serious.
Yeah.
And it turns out like 2 days later, they found I had an abscess that grew. It was the size of a watermelon, a fluid-filled abscess that was crushing my organs. Wow. That is why I was in severe pain.
Yeah.
It wasn't because I was just being sensitive. Yeah. And that's what she gave off. She gave off like, you really should try to get off the pain. Like I was, just some weak wailing, whatever. I was like, is she serious?
Yeah.
Does she understand I can't even breathe because this pain is so severe?
Yeah. So everything you just said just resonated because this is a tangent. The opioid epidemic.
Yeah.
Research showed that there were percentage-wise less African Americans that got addicted to opioids, not because they didn't want the drugs, but there was this bias that
they were given
for pain meds. It's like, oh, you're just using it, so they were less likely to get the drugs as opposed to. So it's just crazy. It's seeped into our system.
It is.
And that's why there's such a fear around AI, because what they don't want to have happen is all this bias that exists in our world.
It seeps into that.
A computer just spits it out.
Oh, well, but that's about the people that create and program systems. It's actually very critical, right? When you look at EGFR, right, that's a way where the EGFR, which is it's the test rating that determines the stage of kidney function that you're in, right? I forgot what it actually stands for, but that's what that's for, the EGFR. There used to be, and it's just recently changed, like months, right? Maybe last year sometime. Tell me if I'm wrong, but it used to be that there was a rating in your blood work for African American EGFR and then just regular EGFR. And if it was African American, they gave you they called your level of kidney disease less at higher numbers compared to those who are non-Black.
Yeah.
Which, what the heck is that?
Yeah. I hear you. So, for example, for bias, we control for it to ensure that we reach out to everyone equitably. So when we did our work around recertification, we ensured that we were not leaving anyone behind. If we only reached out on telephone and digital, we would have left populations behind. Right. We only reached out to people who have iPhones and we didn't do Androids, we'd have left people behind.
Yeah, poor Android. No, I'm just kidding. You used to be one of them.
Absolutely. So we were very strategic ensuring that no one was left behind, everyone had an equitable chance to recertify. The other thing we do to sort of combat bias is we work on something called our Health First Quality Incentive Program.
Okay.
So this incentives we give our physicians for meeting certain metrics. So here's an example. We'll say to a doctor, how many patients do you have that should have a mammogram? How many patients do you have that should have a colonoscopy? How many patients should you have that should have a lung cancer screening? Whatever that number is, we say, great. If you can get to, for example, 90% of those patients getting those services, we will give you a financial reward.
Oh.
So now the physician is incentivized monetarily to try to hit to 90, which means they're not going to cherry pick. I'm only going to talk to my Hispanic patients and my white patients. They're going to get to everybody. And so by paying them to get...
Incentivizes inclusivity.
Exactly. And so that's another way we get through health equity through our physicians as well. And then we look at the numbers. We knew that, like, for example, we saw early
Principal, what's his name is the Bronx principal.
Oh, he joined.
Hey! One of your Bronx partners, right?
Absolutely. What's up? That's amazing. So we take bias into consideration and we look at the data. So when we saw that certain populations had a higher recertification rate than other populations, then we doubled down to say, how do we get those populations to have a much higher rate? And where are they located? And what doctors do they use? I'll give you the last example. If there was a population that had a lower recertification rate, what we would do is say, I can't get them on the phone. Maybe the phone number Health First has for them is wrong. Reach out to their physician who had their last visit and see what contact information that doctor has and see if we can still contact them. So we literally were trying.
Wow.
And then the last one is we actually went to door to our most vulnerable, older members. Just sure that, hey, we tried you in every single way and you didn't respond. I need to see if you're there.
Wow.
And if we were there, we would walk in the home and literally help you on the spot.
That's awesome. That's phenomenal.
Yeah.
It's very strategically intentional.
100%.
And I think it's important to say, why is this so important? Like, what's at risk that this had to be the level of action?
Yeah, I mean, the biggest one for us was the fact that there's studies that say 18 million people are going to lose their coverage, right? The fact that there was close to 50-60% of people didn't even know what recertification was.
Right.
And that's why we partner with you to be in the community explaining this in terms that the community can understand in a culturally sensitive way. And then the other piece was we already know there's disparities. We already know.
We don't need this to be another disparity. For you to
exacerbate it. If people lose their coverage, it's only going to exacerbate the disparities they had. So if you're taking chronic medication because you need medication and everything.
High blood pressure, which is the number one killer of Black women, right? Let's say you have high blood pressure and you literally have this is one of very good examples because it's one of the diseases that has no symptom until it's too late.
Yeah.
Let's say you fall into this category, you lose your coverage and you have high blood pressure. And I'll give you, myself as an example. I eat right. I live and I practice what I preach. But because of kidney disease, that is genetic, dominant kidney disease in my family, literally there's nothing else I can do lifestyle-wise to change my blood pressure issue. It is because of decreased kidney function, just because of the genetic disease. And I'm doing great compared to like people in my family who no longer are here at my age, right? Or more, et cetera. But again, I'm grateful, but I have to have the blood pressure medication because it's the only thing that lowers it to where it keeps my kidneys from getting worse, right? Yeah. So if I don't have that medication, I'm not going to know something bad's happening until it's too late.
Until it's too late.
Because you don't walk around and have symptoms. And more than 50%, let's go back to Black women here, more than 50% of Black women ages 20 and over. We're not talking about older women. We're talking about Gen what, millennials
Millennials.
and Gen Zs, 20 and older, have high blood pressure and don't know it. They don't know it. So here you are, let's say you are diagnosed. So number one, if you need to know what your numbers are on a regular, we need to be monitoring our blood pressure at home. Seriously, that's just, it is critical.
It's super cheap at the pharmacy.
You can get a blood pressure cuff on Amazon, at CVS. Like, it doesn't have to be expensive. Okay. Yeah. And guess what? And some insurance payers cover for blood pressure med cuffs as well, right? Absolutely. So here you are. You need to know your numbers. You now fall out where don't have insurance, and you don't have your medication. You've tricked yourself into thinking everything's okay because, hey, I'm not falling down, I'm not losing consciousness, I feel the same, until you have a massive heart attack, or until I developed an aneurysm. Mm-hmm.
It's scary.
Until that's not where you want to be.
Right. The other thing too is, if you do disenroll, say God forbid you lose your coverage, right? Mm-hmm. Without, the minute you find out and you try to re-enroll, it's usually the first day of the following month. So there's a gap, and you don't want to walk around with a gap in coverage. So say you lose your coverage on April 1st. So March 30th was your last day you're supposed to renew. You don't renew, so you lose your coverage April 1st. On April 2nd, if you go back to say, I want to enroll for coverage, May 1st is the first day.
Wow. So you have a whole month of, do you know what can happen in a month? Anyway, so that's in a minute.
Don't even lose it, because it takes a while for you to get it back. So just keep it in the first place.
Somebody says they can contact New York State of Health for backdating.
They can. So Betsy is in the know. But why go through the hassle?
How much of a hassle is it to go? Do you know how much of a hassle it is to get New York State of Health?
That's true. Sometimes they have long wait times. That's true.
Yeah, no, but that's good information, Betsy. Thank you so much for sharing that. Okay, so just to recap, we know who's at risk. Again, I want to be clear. This is not just, people who are low income. Like, let's go over what the products are, because it's children who are insured.
Yep.
Right. To just kind of go through that again.
Yeah. Child Health Plus is for any child. Undocumented children can enroll in Child Health Plus, undocumented children. And it's any child for parents that make between 138 and I think 400% better poverty level. So that's like, $20,000 up to even $60,000. They can put their kids into Child Health Plus. Medicaid is for children and adults that are making $15, $16 an hour or less. Mm-hmm. If you make too much for Medicaid, then you go into something called the Essential Plan. Essential Plan is people can make up to $45,000 in Essential Plan. And it might be even higher depending on how many kids you have. So everything I'm talking about is if you're an individual. If you have kids, you can actually have a higher income and still get eligibility. If you make too much for Medicaid and Essential Plan, the next product is called Qualified Health Plan, or QHP. That's the Obamacare plans. And that product, you get subsidies from the federal government. You can find a plan for $10 a month, $50 a month, and still get coverage. So essentially, no matter what your income is, we will find a plan for you. And it's important because it's still 5 more months of people who are in Medicaid, Child Health Plus, and Essential Plan to renew their coverage. And the last thing I'll say is it's seniors over 65 that also have Medicaid. They also have to renew their Medicaid as well to keep both lines of business intact.
Betsy said, that what about there's for the small business owners?
Yes, so small business owners, they already renew. They're supposed to renew their coverage every year. And that process never stopped. They have to keep renewing their coverage every year. I like Betsy in the industry.
No, come on, Betsy. Yeah. So let me ask you a question around, if you are someone who ignored all the calls and now you're finding out, oh my goodness, maybe you just don't like to go to the doctor, and you find out that
Betsy works at Health First. What's up?
Oh, hey, Betsy. I love it. She's an agent. Thank you for the information. if you are a person who didn't know it, you ignore your calls, they've knocked on your door, everything, and you find out you have your coverage is lapsed. What do you do now?
Yeah. So Health First has 26 now locations all across New York City and Long Island where you can walk in and say, I don't even know where to start. What do I do? So you can walk in at any time or book an appointment and go. Healthfirst.org, our website.
Yes.
We have information for you. It's healthfirst.org/renew-your-coverage.
Really? It's all that?
I know.
So if I go to...
But if you go to healthfirst.org, at the top, you will see a banner that says renew your insurance.
That's what you need to hit. Hit the renew. Look, I'm going to go there right now. I just want to make sure it's that simple. Right here. So go to healthfirst.org.
Healthfirst.org. Right at the top, renew your healthcare coverage.
Healthfirst.org. And then go right at the top. Let's see. Yep. Right at the top, y'all. Big old green bar. It says renew your coverage. It's true. So that is also, will you find the locations to walk into from there as well?
Absolutely. Yeah. And then I saw in the chat, healthfirst.org/renew. Just /renew, you can do it too.
But I mean, if you go to the homepage, it's right there at the top. You can't miss it. So it will tell you
when you call,
need to renew, know your renewal date, watch your mail, email, renew your coverage. I'm looking. Yeah, it says here are mobile units. All of that is on that page. Yeah. So everything we've been talking about. So if you realize, oh, now you're on this live and you realize this is why they've been calling me, go to the website. All right.
It's never too late, and we'll help you through it. So sometimes I don't know what paperwork to bring. Just walk in. We'll figure it out. You know,
and your phone customer service is fantastic too. Like your care, the actual people who sign you up for your insurance plan. Christian, shout out to Christian, who always takes care of me and my family. So we'll take you through, ask you all the questions, help you enroll. It's just, listen, we cannot afford to have we already talked about the disparities. Yeah. We cannot allow lack of access, lack of health care to be another disparity. We can't.
100%.
We can't.
100%. And I'm glad you talked about the people who are in the field, enrolling people, helping people. Like, for example, Betsy is in our call center. We hire from our communities.
Oh, that's awesome.
So we treat our members that join Health First like our family because we're in the community. We live with them. We're in the community with them, you know? And so it's meaningful to us. We mean what we say.
You're trying to say that the call center is not overseas somewhere. That's a very good... They speak our language, 57 languages, right?
Absolutely.
Right. So I appreciate this. You want to know, if you don't know what your status is, go to healthfirst.org and reach out via mobile, via phone, go to the one at centers. You will get support to find out where you are and what you need to do, right? Because that's really it. The worst thing we can do is not know.
Right.
That's the worst thing you could do, because not knowing and then you need it, that's just not a place you want to be.
100%.
Ever. So thank you so much for joining us. This was, if this is not for you, it's for somebody you know. It's for plenty of people in your family need to know this information. Okay. And if you are outside of New York, and it's not, Health First is not your carrier, this still applies to those who are outside of New York, because this is affecting anyone with Medicaid around the country.
Exactly.
Okay?
Exactly.
So you need to call your healthcare provider and find out your status. All right?
100.
Any parting words, my friend?
Make sure you act. Make sure you act. Don't wait to lose your insurance to try to sign up for it. Don't find out you don't have insurance when you're in the doctor's office.
No.
Like, this is the time to take care of it.
Let me ask you a Betsy just said chat. Can you do this in the chat?
We do chat. So you can text to chat, talk to chat online. We can answer questions.
is that like, I'm trying to find it on the website. Is there a little pop-up that says chat or something like that? Let me see. I'm on the renew page now. Very
I
important.
don't know if I don't.
But bottom line is all the access you need is there.
Yeah.
Okay. So, and this will be rolling through July in the whole country. This is going to be an imperative issue, right?
Absolutely. So
the chat button. Were you? All right, Dr. Pierre. Thank you so much
thank you.
for this time.
Thank you.
I appreciate it.
Have a great day.
So thank you everyone for joining us this evening. Well, joining us today, because whenever you hear this, it's going to be now for you. And please, if this is not for you, share it for those you need and who need it, those who you just bring up the conversation, because there are people who you talk to on an everyday basis. You know, did you know what I heard last night? Did you know what I heard the other day? Do you need this information? Please. We have to help one another just to not fall through the cracks. That's part of how equity happens as well, right? And if you're someone who is needing support, our team is here for you to help you to find the right plan in terms of whether it's a nutrition plan or the right supplement plan to help you specifically to make lifestyle changes. Please go ahead and take our free quiz at thedetoxnow.com. If you're dealing with fibroids, reproductive health issues, you're trying to improve your cardiovascular health, your digestive health, and you want to know what lifestyle changes you can make in cooperation with your physicians, please, we are here for you. You can book a free consult and we will walk through this with you and help you to live the healthy life that you deserve. So go to thedetoxnow.com, take the free quiz, get the free consult, and let's build a life together. Thank you so much. We appreciate you. Health first in the house. Good night, everyone. Take care. Bye-bye.